The surge continues. The Philippines breached 5,000 new cases yesterday, the highest we've seen in 7 months. This after health authorities confirmed 2 new variants of the coronavirus in the country. With these alarming numbers, the NTF says it will revisit its guidelines to respond to the surge in cases more effectively. But IATF is still not compelled to reduce the allowable capacity for mass gatherings in GCQ areas, including religious activities. This as the DILG insists that a uniform curfew around the metro is actually curbing virus transmission. More recipients of the Astrazeneca vaccines abroad are reporting unusual side effects such as blood clots. The WHO probe on these reported side effects from AstraZeneca shots is now underway. The International Health Organization says it's safe to use the vaccines while investigations are ongoing. Fast, focused, and fearless. Here's everything you need to know to jumpstart your day. Sunday, March 14. I'm Riza Diaz. The Health Department reported 5,000 new COVID-19 cases yesterday, the highest daily surge since August of 2020. This brings the country's total caseload to over 616,600, some 56,000 of which are still active. This comes after the DOH confirmed a new COVID-19 variant called the P3 variant, which first emerged right here in the Philippines. The country now has 98 reported cases of this virus type. Health authorities said that all available data is insufficient to conclude whether the variant will have significant public health implications. But prior to the confirmation of the new variant, Japan already reported that they found this new virus type in a passenger from the Philippines who arrived in the country on February 25. Detection of the first case of COVID-19 Brazil variant called P1 was likewise confirmed by the DOH yesterday. The Health Department says this variant was detected from one Filipino who traveled from Brazil and back home to Western Visayas. P1 is a variant of concern associated with increased transmissibility and a potentially higher resistance against antibodies. A health expert urges Filipinos to strictly follow minimum health standards following the emergence of new variants. UP National Institutes of Health Dr. Eva de la Paz said that the prevent, detect, isolate, treat, and reinterrogate strategy of the government is very important in containing the virus. De la Paz also notes that a virus mutates all the time, so we need to lower the country's case count.
Every infected person or it's a chance for the virus to mutate itself. So the more cases we have, the more chances the virus has to mutate. And so if we bring down the cases, then that in itself is a way of lowering down the chances that the virus will mutate and come up with this new variant of concern.
De La Paz also stressed the need to boost the vaccine confidence to achieve herd immunity. She adds that the country must procure a significant number of vaccines to protect the majority of Filipinos.
We have to be able to vaccinate as many people in the population as possible because this will lower our cases. So babalik sa lowering of cases, which gives the vaccine lesser chance to mutate and become a better virus. And so this can help in the prevention measures.
Now, with the current surge in cases, the National Task Force against COVID-19 says they will be revisiting their guidelines to combat the virus more effectively. NTF COVID-19 spokesperson Restituto Padilla told One News that a large part of these efforts should focus more on boosting contact tracing, which he said is often ignored.
We really need to strengthen contact tracing, but we do understand that a lot of LGUs have taken a slacken up a little bit on contact tracing. So we need to reinforce all of these measures that we have implemented last year and probably reinforce and not only reinforce it but strengthen it further in light of these new cases that are coming and the mutations that we are closely following.
When asked if the government is likely to impose lockdowns on a wider scale, Padilla said it is not an option. He added that it's better to stick with a quote hammer and dance strategy. After all, if LGUs prefer to conduct their own lockdown, they still have the liberty to do so.
The easing is to give way to the hammer and dance strategy of government and allow for a delicate balancing act between the re-energization of the economy as well as the protection of public health.
Now, despite these developments, people gathering at 50% of venue capacity is still allowed in areas under GCQ. Palace spokesperson Harry Roque said that the IATF has not revised the prevailing rule for mass gatherings in venues. Roque said it suffices for now that the local government units have been directed to strictly enforce health protocols. Last month, the IATF increased the number of people allowed to attend mass gatherings from 30% to 50%. This also covers the conduct of religious activities or services. Meanwhile, the DILG insists uniform curfew hours and granular lockdowns across the metro is the key to curb surging cases. DILG Undersecretary Jonathan Malaya confirmed that NCR mayors have agreed to impose a uniform curfew from 10 p.m. to 5 a.m. starting tomorrow. Essential personnel such as frontline health workers, PUV drivers, food delivery services are exempted from curfew. Workers returning from or going to work are also exempted if they can present proof of employment at checkpoints. LGUs will determine their own sanctions on violators within their jurisdiction. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. 3 health workers in Norway who were given Astrazeneca vaccines are being treated in a hospital for bleeding, blood clots, and a low count of blood platelets. But the Norwegian Medicines Agency said they are still unsure if these unusual symptoms are directly caused by the vaccines. The European Medicine Agency will investigate 3 ingredients of the AstraZeneca jabs. The NMA notes that these are very unusual symptoms and that they will take it seriously. The prevalence of such adverse effects have prompted many countries to suspend the rollout of the AstraZeneca vaccines, but the Philippines has no plans of following suit. That's according to Dr. Ana Ong Lim of the DOH Technical Advisory Group. She says it's likely that not all of the side effects are caused by the shot. She added that they are still looking for a conclusive link between the vaccine and the reported adverse effects following immunization.
Kailangan maintindihan ng mga tao na hindi lahat ng nangyayari matapos mabakunahan ay kasalanan ng bakuna. No? So, pwedeng nagkakataon lang o yung tinatawag na coincidence, pwede rin naman talagang tukoy na galing sa bakuna o may causality. So, tinitignan particularly dito sa usapin ng blood clots na ito, yung rate, kung gaano ba kadalas yan ma-report bago nagsimula ang bakunahan, and kino-compare dun sa dami ng mga kasong inire-report matapos nagsimula ang bakunahan.
The WHO is now reviewing safety signals and carefully assessing these reports involving AstraZeneca shots. WHO Director General Tedros Ghebreyesus said they are aware of the suspension of use of AstraZeneca in several countries. But the WHO official said it's safe for countries to continue vaccinating its people using the Oxford-made jabs while their probe is ongoing.
It's important to note that the European Medicines Agency has said there is no indication of a link between the vaccine and blood clots, and that the vaccine can continue to be used while its investigation is ongoing.
Now, all of these things considered, what then is the best COVID-19 vaccine available to us right now? Emory University's Carlos Del Rio answers that question on Bloomberg Quick Take. Let's listen in.
The best vaccine is the one you can get into your arm. All the vaccines that are currently available are actually very effective in preventing you from getting sick, preventing you from dying, preventing you from getting hospitalized with COVID. So I would say take the vaccine being offered to you. The most important thing is to be vaccinated. Some vaccines may be better against some variants than others. Some vaccines may be better in older people than others. I think we still need a lot of research to understand that data. Some vaccines may have longer protection time than others. The research has not ended. Right now, what we have is emergency use authorization. That means there's a public health emergency and the vaccines are being authorized to use because of the public health emergency. But they're not yet fully authorized, and that is pending some more studies. And, research is still happening. We're in the middle of this crisis. We're trying to get over the crisis. Then we'll figure out what happens long term. But in the meantime, even one vaccine is better than no vaccine. And get vaccinated because, what will happen later? It reminds me about the early years of HIV. We use antiretrovirals and we said, here are the antiretrovirals you have. And we're starting an antiretroviral therapy. And we saved thousands of lives by starting people in what I think were not the best antiretroviral drugs. Even back then, even in the US, we're using drugs. And nowadays, I get chills to think that we were actually giving that to people, but it saved lives. Now, if somebody back in 1996 would have said, no, I'm going to wait until there are better drugs, they would have been dead. There's a lot of very smart minds working on COVID vaccines. I think we're going to get much better vaccines. I think we're going to be talking in 3 to 5 years about very different vaccines.
And that's how the day is shaping up to be. Join us later at 10 in the morning as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.